Welcome to the Health Occupations and Long-Term Care Subcommittee. I'm sorry, we're starting a few minutes late today. It is getting to be that time of year. It is 11:15. We are going to go till 12:15 to make sure that the HGO committee members get a break. They had a very long day yesterday. I want to make sure that they get a break. Just for the stakeholders who are watching, we do not expect to get through most of these bills today. We will discuss them and come up with a plan. We are expecting for the subcommittee to meet twice next week. So we will move what we can today and have a discussion and get an update and come up with a plan of action for the bills that remain to be taken up again next week. So with that, the first bill that I believe is ready to go is House Bill 1051, the Howard County and Montgomery County Adult Daycare Services Pilot Program. We do have some amendments, I believe. I'm going to hope that Bryson Popham is here to give us an update on these. If he's not, we can toss it to Lisa. Why don't you tell us what we have, Lisa?
So House Bill 1051 establishes the Howard County and Montgomery County Adult Day Healthcare Services Pilot Program to integrate the provision of medical adult daycare, home health care, and medical services provided under Medicaid. There are amendments. There's two amendments. One is on page 13, and that one adds a member of the Alzheimer's Association to the task force and adds to the duties of the task force recommendations on implementing the pilot program statewide. And then there is also an amendment on page 14 that requires the task force to compare the pilot program to the program for all-inclusive care of the elderly.
So if people remember from last week, we had this discussion, but we did not have these amendments. So I don't think we need too much time for the discussion. With these amendments, everybody is on board and happy, and the Senate has moved it this way. So are there any questions?
Amendments?
Perfect, moved, and I'll second them. Any discussion on those amendments? All in favor, say aye. Anyone opposed, raise your hand. Perfect, amendments pass unanimously. On the bill as amended.
Move the bill as amended.
Second.
Moved and seconded. Any further discussion on the bill as amended? Seeing no hands up, all in favor. Oh, Delegate Krebs, yes.
Thank you, Madam Chair. Is there on this rollout recommendations, when is that due and to whom? And then will we act like next year? Just as make recommendations, but is there a timeline on that?
I think it's 3.5 years, if I remember correctly. I'm sorry, I don't have the.
No, the amendment just says make recommendations regarding the implementation of the pilot program on a statewide basis. That's on the recommendations. And then comparing the differences and similarities from the PACE program and this, is that just going to be done when the pilot expires or prior to the pilot expiring?
I'm hearing the stakeholders don't have the link for some reason. So Sharon will make sure to get Joan Smith the link to the subcommittee so that they can answer any more questions on this, because I bet they have specific answers and they just need the link. So why don't we put a pause on this one since we have moved and seconded it. Hold on, Sharon is sending it. Hold on, I'm texting you. Sharon will send it.
It does say on or before October 1st of each year, the task force shall report its findings and recommendations. But with regard to these two amendments, I assume that's included in that as well. I mean, I really clearly think we need to, a lot of times we pass stuff and we don't follow up with it. And this is something that's really important and we've got to make sure we follow up with it.
Yeah, and I know that this same exact conversation happened over in the Senate side, and there was a robust conversation, and I know there are answers to those questions. I don't have them, so let's wait until Joan gets here. Joan is here. Hi, Joan.
Hi. Come on in here.
So Delegate Krebs was having questions about timelines and reporting. Do you want to repeat your questions, Delegate Krebs?
Yeah, well, I see that we do have the amendments that we asked for, which I appreciate. The one about make recommendations regarding the implementation of the pilot program on a statewide basis. Like, what would be the plan to roll it out to the other counties? As I mentioned before, we're doing this to the two most wealthy counties basically in the country, which is great. But there are many of us that would like to be part of this kind of. And then the second part of that question is the timeline for comparing it to the PACE program, and then when will we see that and make some decisions based on those items?
Okay, I just had some technical difficulties. I'm going to let Bryson sit down in my chair.
Okay,
Delegate Krebs was asking about the PACE program and the timeline, the 3.5-year timeline.
okay. Delegate Krebs and members of the subcommittee, thank you. Bryson Popham here. The language about the PACE program was added at the request of Senator Augustine. He has an expansion of the PACE program planned for Prince George's County, so he quite naturally was concerned about the interaction of this integrator program with the PACE program, a very logical concern. And we, because the bill is really kind of a triple threat, it has the implementation, but it also has the study and the pilot. We thought the simple solution would be to add language comparing the integrator program created under the bill with the PACE program, especially if you read the amendment, including differences and similarities between the PACE program and this one. That was, I think, pointed at Senator Augustine's specific concern. He didn't want any duplication, and nor do we. So we thought that would address his concerns and would be an appropriate subject for the task force to take up. And Senator Augustine and his fellow members of the Finance Committee agreed with that.
And I'm assuming, that's a great amendment. I'm assuming, though, that when the first amendment about the recommendations about the implementation of the pilot program is going to also include the findings that about the PACE program and making sure it's all working together. It's all included. Is that the intention? I can't see where this is fitting into the bill, but
yes,
I'm making sure that's the intention and what the time frame would be.
Yes, that will be included. The PACE program study by the task force will be included in the report. The recommendations, which was your request, and we took notes and we tried to duplicate the request we heard you make in subcommittee. I think if you need more specificity there, that can be provided, but we believe that the study, when it comes back, will say we either recommend or we don't, and hopefully they will recommend that this be implemented on a statewide basis, and they will flesh that out in their report. We didn't think that we should provide the specific conditions or requirements for the task force addressing that issue. But if you want to, we certainly can do that.
And the way I understand it, we've got to apply with CMS to get a waiver for this, and that's going to take some time in itself. Is that correct?
Actually, that's not correct. If you're referring to the health department letter,
Yes.
it is, with all due respect to Secretary Schrader, it's not clear, and the pilot program itself is not going to require a waiver because it does not provide any of the health services that would be subject to a waiver application. This is a coordination function at this point. When the pilot has finished, when the General Assembly receives the report, you may decide to request that the health department seek a waiver for some or all services that were covered under the pilot program. But it's premature to do that now. I should point out that this pilot program incurs no financial liability on the part of the state. Howard County and Montgomery County graciously are providing the staffing for it, and they will be participating in it. And if you look at specifically in the bill, Delegate Krebs, at the definition of integrator, it makes it clear that it is a voluntary program. It doesn't require anything of anybody. So.
All right. Thank you for clarifying that, and good luck with it. Thank you.
Thank you. Any more questions on this bill that has been moved and seconded? Looks like it's good for the committee. So all in favor say aye. Aye. Anyone who's opposed, go ahead and raise your hands. Looks like it passes unanimously. Thank you to the members of the committee, and thanks Delegate Krebs for the great discussion. Let us move on to House Bill 972, which we also discussed last week, continuing care at home certificate of need exemption. I understand Lisa was burning the midnight oil on some amendments on this one. So why don't you give us an update? Lisa?
So this bill exempts continuing care at home certificate of need requirements by altering the definition of healthcare facilities for the purposes of providing an exception to the requirement for a CON. There are amendments. Let's see.
Tell you what,
I think somebody needs to mute their microphone. Somebody's got some dialogue in the
anyone
background.
ask any questions?
Delegate Morgan, can you mute, please?
Oh, I'm sorry.
So there is an amendment on page 10 of your packet, and the amendment provides an exemption from the pre-sale agreements for providers that satisfy the reserve requirement and either hold an escrow all entrance fees or maintain $1 million in security until the provider breaks even.
Okay, and I believe this amendment was worked out between a couple of different stakeholders. I'm not sure who all is here. I see Aaron Greenfield. I think Arnold Epley and Brad Paulus I see Brad. Okay, so let's go to Aaron first. You can tell us where we're at and if people are okay with this.
Yes, thank you, Madam Chair, and thank you, committee. I know you have a huge agenda. I'll be very quick. Leading Age supports these amendments, as I understand that the Secretary of Aging has reached out to your office and made clear that she has no objection as well. So we are on board.
Yes, the message I have from her is that they enthusiastically support it to remove the pre-sale requirement. And that they added additional consumer protection, which I believe is in the amendment that we have before us, correct? Wonderful.
That's
so
correct.
Do we
Yes.
have anything to add from Brad?
No, I represent Wesley as well as some other communities who are looking to add continuing care at home, and they all support this amendment.
Excellent. Do we have questions from the committee? I see no hands up. I'm going to move the amendments.
Second.
Moved and seconded. Any discussion on the amendments? All in favor, say aye. Anyone's opposed, raise your hand in the chat. On the bill as amended.
Move the bill as amended.
Second.
Moved and seconded. Any discussion on the bill? I see no hands up. So all in favor, say aye. Anyone who's opposed, raise your hand in the chat. Go team, passes unanimously. Thank you all. And thank you especially to Lisa for doing these last minute amendments, and really appreciate the collaboration on this. Moving on, we have, okay, we're already into our bucket of bills. Let's get an update from Delegate Bagnall. We may be able to move something here. How are we doing, Delegate Bagnall, on your bill, which is 911?
Things are moving rapidly.
Okay.
We just got confirmation from the board that they are accepting the amendments that were proposed by Dr. Savage. And I just want to make sure that we have the correct amendments, because we had sent draft language to the committee and committee council for two amendments for consideration and discussion. We didn't know that we would be at consensus. So we did the bill, the amendment that was requested through the amendment office is, I believe, the amendment that is being approved by the board. And I think we have all the stakeholders here as well. And I'm working with my chief of staff right now to make sure.
Why don't we do this, Delegate Bagnall? Because we will be meeting until 12:15. So I'm going to come back to you at 12:10, because it sounds like you just want to cross your T's and dot your I's, which we love. So we will come back to this bill at 12:10, but we will save 5 minutes, because it would be great if we could get this one moving. Sound like a plan?
Fantastic. Thank you.
I just want to point out, there is one amendment that had been sent to me last night that's in draft form that was in the packet I sent. And then I believe Delegate Bagnall, your office separately sent around amendments. So I'm not sure where the agreement is on which set of amendments, but.
And that's why I'm
Working to figure that out.
Yeah, no, that's fine. Yeah.
Thank you so much.
We will make sure that if we vote on this, the committee has a chance to see and discuss the actual amendments that are agreed to. Okay. So let's go into the nursing workforce bill. So I think we have to really just do discussions on workforce bills at this point. I'm not sure if any of these workforce bills are going to be ready to move this week. A lot of the workforce bills have common themes. So since none of them are probably able to move this week, and since there are so many common themes, I'm looking at the Healthcare Workforce Expansion Bill, which is 1208, as well as the Administration Bill 407, and the Commission 625, all have really similar themes. 1, 2, 3. Let's see if there's anything left. Wait, maybe let's discuss 1034 so we can take that off the table. 975 is similar themes with the others. So if we do 1074 now, I'm sorry, 1034 now, then we can have a conversation about all the remaining workforce bills that have all the similar themes and make sure we have a plan of action for all of them. So 1034, I believe that Lisa can give us an update on this. I believe we are not ready with amendments yet. I believe there is someone from Delegate Peña-Melek's office to give us a bit of an update, and we can go to Dana Kaufman for an overview of where we're at. Lisa.
I mean, the bill renames the State Board of Examiners of Nursing Home Administrators to be the State Board of Long-Term Care Administrators, and requires that an individual be licensed by the board to practice as an assisted living manager. And yes, Michelle Furman is here from Delegate Peña-Melek's office.
Excellent. Michelle, why don't you give us an update as to where we're at here?
Hello, everyone. So we did finally come to a consensus about a 1045 today. Those amendments were circulated to you in draft form. We do have Dana and our other stakeholders here. Dana, do you want to explain them, the amendments?
Sure. So Chair Kelly, I know that there were 4 different documents that were circulated. How do you want me to go? How much detail do you want me to give? I can run down the amendments pretty quickly.
Are we in a place where we can, like, where there's agreement on the amendments and just the committee doesn't have them, or the committee hasn't seen the final copy of the amendments? What's this process status of the amendments?
So right now what the committee has are different pieces of the amendments, and there's a substitute amendment for an amendment, and there's no reprint. It would probably be better to have the full reprint. So everything, we can make sure that everything connects. That's just my personal view.
I imagine, I'm looking at Lisa, but I think that's probably an easier thing to do. So let's talk about the content of the amendments, but we won't move anything. And then we'll put this on the top of the agenda, hopefully in the place where Bagnall's bill used to be for the first meeting next week to keep it moving. That will give us time to look at the reprint. But why don't you tell us the content so we can have that discussion now?
Okay, so for what, as what Lisa said, for what this bill does is it's basically requiring assisted living managers to be licensed under the current BENHA board, which will become the State Board of Long-Term Care Administrators. But what it's also doing, since it will be requiring all individuals who serve as managers to be licensed, then they also have to take a manager course. So you'll see a separate sheet that says 19-1807. We just need to we had to make changes to the current law to reflect the fact that currently managers who are employed in communities with 4 beds and under don't have to take the manager course. So we've made changes to ensure that they will be taking the manager course, and it will coincide with the date of licensure, which is October 1st, 2024. And then there was a couple other little changes that were corresponding changes. Then the bigger document, the bigger changes is that the board now will have equal representation between nursing home administrators and assisted living managers. And since the bill takes effect October 22nd, but the licensure doesn't take effect until October 1st, 2024, we want to get managers on so that they can work with the licensure. So there is provisions for appointing the managers before they're actually licensed, and some qualifications for that. The bigger issues deal with just ensuring, because this is, we have current requirements, current programs. This is a big change for the industry, so we don't want to upset the entire industry. So we're going to keep some of the same requirements right now, which will be that every manager has to take the 80-hour course. We are grandfathering in those that were previously grandfathered in before. The education requirements are actually in our current regs were stricter than what was in the bill. So we're referencing the regs for that. What are other some of the stuff? There's a couple little changes for when you are, when you don't have a manager, your manager leaves unexpectedly. Right now, every board has a provision about appointing a temporary assisted living managers already had that process in place. So we were making some changes to that and recognize that we have an alternative manager. Just trying to go through since you're not voting it. I don't want to take up too much time. There are some additional sections dealing with penalties that the board was looking at that we were acquiescing to, but also giving a chance for membership for managers to come into compliance beforehand. And then there's also a report that will be due October 1st, 2023 to the HGO Committee and Finance by the board that really just gives a status update on where they are, staffing, technology, time frame for informing, just so we know that everything's in place before this launches, so we don't have any hiccups during that time. And I think that's pretty much the quick and dirty overview. And I said it was quick because I don't want to take up too much time because I know you have a big agenda.
No, I appreciate it and clearly appreciate
the
stakeholders working on this. It looks like Eric Colchamero has something he wants to add. Eric?
I want to say thank you to everyone for working on this and for the industry's work to make this happen. This would be a very significant shift. Dana said a lot there. The one thing I did just want to flag was that there are, as folks know, quite a few assisted living facilities. And one thing that this bill does include is a grandfather clause. So if I'm understanding the provision correctly, and Dana and the bill sponsor can explain more, it does exempt folks or offer the chance of an exemption from this requirement for existing facilities.
Do
you want me to respond?
Sure, and then we'll go to the questions from Delegate Krebs and Delegate Saab.
Okay, it doesn't exempt anyone from licensure. What it does is, as of January 1st, 2006, that's when the bill went into effect that required the manager training course. So at this point, except for those who are in 4 beds and under, every manager to be employed has to have that training. So they have it right now, but in that bill, there was an exemption for those who had already been practicing. We've carried over that exemption. Those individuals have been subject to the 20-hour continuing education requirements since that time. And then we're adding the smaller providers to that training. So there's no exemption from licensure. And then those who are already working, we're just deemed that they've met them because that's how it's, they've had to do it since 2006.
Thank you. I think Delegate Saab had his hand up first and then Delegate Krebs. Delegate Saab.
Thank you, Madam Chairman. So I guess who's here from the Board of Nursing? Is it Eric or who can?
My name is Sierra Lee. I'm the Executive Director of the board.
Okay, how are you? Oh, that's right. How are you? Sorry, I didn't see it on there. Okay, so I have a couple questions. How many employees do you currently have that work at the board that process licensing?
Currently, we have 1 staff member at this time. However, we are in the process of hiring 3 staff members at this time.
So if we pass this bill,
licenses.
Right, so if you pass this bill, obviously it's going to create a huge amount of licensure, and I don't know how many you have. Do you have roughly an idea how many you currently have that are licensed administrators?
Currently, we have active 508 current active licensed nursing home administrators, and approximately a little over 900 altogether. That includes inactive, suspended and revoked,
Right.
and all of everything all included.
So if we pass this bill, obviously you're going to have, I don't know, maybe you can guesstimate, I don't have no idea, a couple thousand, maybe 3,000 for all the facility. Do you have the ability to do the licensing? I just don't want to have the same issues with some of the other,
Right.
things that we've had in the past where licenses are not being, giving on time. So do you have the ability to handle the load with all this influx of thousands, potentially thousands of licenses?
Yes, so we would actually have approximately 1,700 new licensees coming in. There's approximately 1,700 assisted living manager or assisted living programs in Maryland. And with that being said, we are saying that we needed 4 additional staff to be added to our board. I would also like to say that with the 1,700 new licenses coming in, that would increase our funding. We are actually going to propose to make our original license fees to $300. So that would have us expect to have approximately a $340,000 increase in revenue. So that would actually clear and cover additional expenditures for additional staffing so that we can operate and license assisted living.
Also,
So
the
you're
report,
confident that you can efficiently and you can handle the workload with this new requirement?
Absolutely.
And you're guesstimating about 2 per assisted living. So if you said
Correct.
17, is like about 2. So you're talking about 3,400 new licenses.
Approximately.
Okay, thank you. Thank you, Madam Chairman.
It
and,
sounded like Michelle wanted to,
Yes.
go ahead. Go ahead, Michelle.
the amendments Deanna mentioned do include a report that would come back to committee to ensure that the board is able to handle the new license.
Okay, Delegate Krebs.
Right, sorry about that. I've got so many different papers here I'm trying to look at. So I have a partial reprint, I have some amendments, but Dana, just a couple things. So it's not 5 or more beds anymore. It's all assisted livings, is that right?
So yes, all assisted livings would have to be licensed. The issue with the 5 beds comes into play because it's only those managers who are employed in facilities with 5 or more beds are required today to take the manager training course. This bill, in addition to being licensed, also puts that requirement on those who are employed in 4 beds and under.
Okay, all right, got that. I mean, and I think having the reprint will be, a full reprint would be helpful. The next part, on the fees, if you don't fail to employ an assisted living manager who meets the requirements, subject to not to exceed a $10,000 fee, that seems high. I'm thinking about some of these small assisted livings. They can't hardly get staffing now, and to have some fun. We don't even charge criminals $10,000 when they commit a bad crime. We charge them $500. So it seems like, we just had one yesterday, $500 for having an illegal gun, and now we're going to charge $10,000 to maybe possibly a small assisted living person because they don't have the right training or whatever. So does that seem excessive for something new like this?
So the $10,000 is for operating without a license. And originally it was proposed as 20,000. So we requested it to be reduced to 10,000. I do agree with you on that. But what we also put in is that for the first year after licensure goes into effect, October 1st from 2024 to October 1st, 2025, the board would have to give the managers 60 days to come into compliance before they would assess the penalty.
I just think it just says an assisted living program that fails to employ an assisted living manager who meets the requirements may be subject to a civil penalty. I just think
that's actually, I'm sorry, that's current law. If you're looking at 1807, so yes, so that's current law. If you are a owner and you fail to employ a manager who did not take the manager training course, you're subject to a $10,000 penalty right now. That's been in law since 2006. The amendments, what we were concerned with, has a provision under licensure that would say that if you are acting as a manager and you are not licensed, the individual would be subject to a $10,000 penalty. And we asked to amend that to say that you had 60 days to be able to come into compliance, because I'm personally concerned of making sure this message gets out.
All right, well, I suggested we get the reprint, look at this stuff and consider that these right now, none of them are even required to be licensed, and they have trouble getting staffing, and we want to professionalize it. But we got to make sure we do it and still have these centers that are able to take, you can't even afford assisted livings now. So we got to, it's a fine balance in what we're trying to do and making sure we continue to have operational, because anytime you require these things,
All right,
it's more
Delegate Krebs, I get it. I'm with you. We're going to take it up next week with the reprint. And we all understand about the balance. I just need to move us along because we have half an hour and like 5 workforce bills. So the stakeholders are here, but you are right. And thank you. Really appreciate it. I'm sorry, was that Delegate Saab, is your hand still up?
Yeah, actually, I just wanted to make sure I heard correctly from the Board of Nursing. So each license will cost $300. Did I hear this correctly?
Yes, we are proposing to have the licenses, original licenses cost $300.
Right, so I did a quick math. So basically, you're gonna have $1 million in revenues coming in for the $300, or at least between 500 to $1 million if you have between 1,700 to 3,400 new applicants. So, but you only said that it's gonna cost 3 more positions. So why is the number $300 if you're only gonna need 300,000? Why the license is so high that it has to go upwards to $1 million?
Well, actually, right now licenses are $200. Each original license is $200, so we would up it because we are having 4 additional staff members. And other expenditures, so we wanted to increase the licensure, but still keep it reasonable. So 300 was the number that we came up with.
Right, but you're still getting $1 million out of these, potentially 3,700. So you still have a lot of cushion there.
Right.
But we can talk about this maybe later too, because I just think it's 300 is too much because you're getting $7 extra $100,000 that you may not need. Thank you.
Yes, thank you.
Okay, we will definitely continue this discussion next week when we have a reprint in front of us. And I thank the members for the productive conversation and for doing their due diligence and reading the bills. I love it. So let's talk about workforce bills first. I see we have Delegate Turner here. So let's go to hers, which is House Bill 821. As I understand, we need an update on this bill. We're not ready to move it yet. I think Lisa has that bill, correct? Is that your bill, Lisa?
Yeah,
okay.
I do.
Remind us of the bill, please.
So this bill establishes the Career Pathways for Healthcare Workers program administered by the Division of Workforce Development and Adult Learning in the Maryland Department of Labor. The purpose of the program is to provide matching grants to hospitals or related institutions that pay for training programs attended by healthcare workers, with the goal of providing increased opportunities for healthcare workers to receive training across the state. A training program is one provided for healthcare workers by a historically Black college or university or a community college. And there's also a requirement that the governor include in the annual budget an appropriation of at least $1 million for the program. There are some amendments. I think they start on page 7 of your packet, and I believe Len Lucci is here to kind of go through what they do.
Excellent. So let's see if Delegate Turner has anything to add, and then we'll hand the floor over to Len Lucci. And I'll remind you, Len, we're doing a discussion of 6 different workforce bills, and we have 26 minutes left to do them. So we're going to try and be efficient, but we'll definitely come back to this next week. Go ahead, Delegate Turner.
Madam Chair, will you just tell us what bill we're on again? I didn't hear what you
Yes,
said.
this is Delegate Turner's bill, House Bill 821.
Thank you.
Thank you, Madam Chair. Yes, I'm gonna let you know. I see that y'all are busy and I'm gonna let Len Lucci walk through real quickly and tell you what happened with the new amendments. Okay, and I agree, with the amendments, and I would love for y'all to pass this bill.
Great. Thank you so
Favorable.
much, Delegate
Yes.
Turner. Len, go ahead.
Thank you, Madam Chair. Good morning. At the hearing on this bill, Maryland Hospital Association had three amendments that they were recommending. Aaron Dorian from MHA is on this call. We would work them through, and these the reprint you have reflects our agreement with one minor tweak, and I'll quickly go through them. The first one is on page 3. It's really a technical change that when there's reports done to the division, it's retrospective, not prospective. It talks about training programs that have been done, not ones that will be done. On page 4, after line 11, we worked out, the original bill said that if you do the certification, get the training done, you get a 10% raise. That gave the hospital some heartburn, locking them into something very specific. So instead, we worked out this language that would be a wage increase commensurate with current labor market trends, and that the employee would get to know that in advance, what that raise, what that extra compensation would be before they chose to take a program. Right under that on page 4, after in lines 14 to 17, and a little bit after that, 3 of the hospitals in the state have joint training and upgrading funds that are negotiated between labor and management. And this simply says in those 3 hospitals, the money will go through the fund only for employees who are a member of that bargaining unit. And it will go, the money will go to the fund, and then there has to be reporting about that to the division. The only thing that needs to be fixed is on paragraph F2, where it says the eligible employer shall report. It should say the training and upgrading fund should report. That's really the only change that's in there that needs to be fixed. Other than that, this is the product of negotiations between 1199 SEIU and the Maryland Hospital Association. We would recommend them jointly and favorably to you.
Great, thank you. Do we have Aaron Dorian here?
Yep, I'm right here.
Excellent.
Thank you, Madam Chair. And thank you, Lynn, and for all the work that we've done together. And I just want to, agree with what Len said. I also want to add that there was one amendment that was left out that we did agree to back on page 3 of the bill under the application process after line 13, where it's a list of training programs that healthcare workers have requested. We'd also like to add a list of training programs that the hospitals have offered. And I think, I believe that was agreeable to SEIU and Lynn. I just think it was a little bit of an oversight.
Aaron's correct. We did agree. It was an earlier version of a reprint and somehow it got dropped out, but we think that's a minor tweak, but we're in full agreement with that as well.
Okay, and then I'm just pulling up the fiscal note and going to ask the obvious question so someone can walk me through. This is $1 million that becomes a mandated appropriation beginning in an FY24, and it assumes funding is provided in FY23. Can anyone talk to me about that? Is there? No. Okay, Delegate Carlson had her hand up. Do you have a question? I think she's on mute.
She's on mute.
You asked my question,
Okay.
Chairman Kelly.
Okay, so this is above my pay grade in terms of spending I'm allowed to do, but I think the committee, and we're about to see, has a vested interest in workforce support. So I think it's important that we have the conversation about this bill in the context of the other bills and the other things we're doing, and we figure out, how we want to move forward. Because it is the stakeholders seem to have agreement, but we still have to figure out where our resources are going. So let's put a pin. It sounds like we'll ask the committee for questions on the amendments, but we'll put a pin in sort of moving this bill until we have the larger conversation. Any questions on the amendments?
So Madam Chair, I did actually want to affirm that what I heard is correct, that with the amendments that we have in front of us and the amendment that was inadvertently left off but agreed to, do we have total agreement between the Hospital Association and 1139? Well, everybody's good on $11.99, sorry. $11.99. Are we all good on that? So the language of the bill is all good. Now we just need to work out the fiscal issues.
Yeah.
Is that correct?
Yes, Delegate Carlson, and with those minor corrections that Mr. Lucci spoke about.
Okay.
Yes,
Great.
and because
Thank
it
you.
starts in fiscal year 24, I mean, it's not something with the current budget we have to worry about, but it will be there. But
Okay.
Do you want to take a minute and 20 seconds, Len, to tell us, to remind us from the hearing why this would be a good way for us to use state resources?
Sure. Not only does the healthcare industry need to find new employees, there's a whole pipeline of employees that where they need incentives to have them move up the certification process and upgrade their certification. And so the Hospital Association and the labor thought this was an excellent way to incentivize that, to keep the pipeline going, because there are immediate things that need to be steps that need to be taken for the healthcare staffing crisis right now in Maryland. But we also need to look at longer term things, and this would work towards that.
Excellent. I do see a question from Delegate Saab, which we'll get to in a minute. I just want to contextualize for the committee. We still have Delegate Charles's bill to hear about, which is the loan repayment program for nurses, as well as the nursing workforce bill that I did, the administration's Healthcare Heroes bill, and the Workforce Commission. So we have all of these bills to discuss. And we have, I'm going to say 10 minutes left before we get back to Delegate Bagnall's bill. So these discussions will obviously continue next week. Delegates up.
Thank you, Madam Chairman. Just to follow up on Delegate Collison's question. So obviously the fiscal note is the concern. Now, I'm aware of some programs that community colleges already are doing this for any business, not just hospitals. So how is this, and I know I probably should have asked this question during the hearing, but now I'm going back because I know Anne Arundel Community College actually will give some sort of credit to the business for continuing education for their employees, and specifically to healthcare. So I guess, this only applies to hospitals, correct? This doesn't apply to anybody else but hospital systems?
Hospitals and anybody who employs a healthcare worker. So that could be expanded to other entities as well.
Okay, so the law is not being redundant, except that there's more money, there's a grant in this one because it already exists.
Right, and this bill says it will supplement, not supplant, existing programs, but the crisis is so real right now that we really think we need an all of the above strategy to get this taken care of.
Okay, hopefully we can work on the fiscal notes. Thank you.
Okay, if it's okay with the committee, I think we move on to Delegate Charles's bill, which is the loan assistance repayment for nurses, 975. Lisa, can you remind us about that bill? I don't think Delegate. That's Lindsay bill. Just kidding. Go ahead, Lindsay.
So this bill establishes a Maryland loan assistance repayment program for nurses and nursing workers and an associated special fund for the program. The bill was modeled after an existing MLARP for physicians and physician assistants. So it applies to nurses and nursing workers who practice in primary care in geographically underserved area, prioritizes those who work in primary care, work in geographically underserved areas, work in an eligible field of employment, which means for government or nonprofit, and agree to practice for 2 years in the underserved areas. The Board of Nursing noted in their testimony on this bill that there's $2 million in the budget for nurse loan repayment assistance now. That money is allocated in the budget to MHEC. This program is under MDH. The money in the budget is allocated to MHEC for their nurse support program assistance fund. It's the budget is allocated for loan repayment assistance for nurses and nursing assistants. I've spoken with staff in the Appropriations Committee. That money they could put in a budget amendment that would take that $2 million and move it to MDH for the purposes of this bill. It would make contingent on the passage of this bill. But the Board of Nursing noted that once that $2 million is gone, if it was moved to pay for this, the bill then foresees payment of this program coming from the Board of Nurses fund at $400,000 a year. unless some other appropriation is made in the budget or unless some other permanent funding structure is identified. There's a work group created a stakeholder work group created in the fund that is supposed to examine how to further incentivize nurses and nursing workers to practice and to try and make recommendations on a permanent funding structure.
Okay, so who do we have here on this bill? This is Len also, right? And it's the Board of Nursing is here as well. I believe I see Karen Evans has a box. Lindsay, I promise I was paying attention to you, but can you repeat just the section about the funding? It is, we would need to change the language in order to get.
There's $2 million right now in the budget. It's line itemed in the budget under MHEC, and it's for Maryland Loan Assistance Repayment Program for nurses and nursing assistants. I imagine, so the reason for that is twofold. One, that language was put in the budget before this bill was introduced. And the MLARP program for physicians used to be run through MHEC. That was changed 2 years ago to be under MDH. So I think it was just thinking that MHEC does this kind of thing and has done it in the past. The Appropriations Committee could put an amendment on the budget to move that money. That is subject to the governor, doesn't have to do it, but would probably do it if the legislature said we've created this long-term ongoing program and we'd like to take that $2 million, which is for nurse loan repayment, and move it to this program that we're creating. But that's $2 million this year. It doesn't speak to out years. And I don't know what the need is, but hypothetically they could spend that $2 million all this year and it would be gone. And then the program would go unfunded unless you keep this language having the funding come from the Board of Nursing. If the $2 million isn't spent this year, it would not revert to the general fund. It would stay in the fund to pay for loan repayment for however long that $2 million lasts until some other funding comes along.
Okay, and then the future problem is that say we use the $2 million over several years, we still don't have a permanent funding source, and that would revert to the Board of Nursing under this bill.
Under the bill, yes, unless you take that language out, which would then leave it unfunded and leave it up to the governor to put in an appropriation for the fund.
Okay, I see questions already from the committee. Let's go to the committee members first, and then we'll hear from stakeholders since their hands are up already. Delegate Morgan.
Thank you, Madam Chair. The current program, how many people are utilizing this loan program for nurses?
This isn't a current program. This is being created in the bill.
Well, I thought we just said there was $2 million in a current program.
It's being allocated to MHEC to pay for loan repayment assistance, but there isn't this program
Well,
now.
how many people are in that loan assistance program?
Well, so MHEC has an existing nurse support program assistance fund. And that fund it says the money in the fund shall be used to pay for competitive grants and statewide grants to increase the number of qualified nurses in Maryland hospitals.
Oh, so it's a grant type. It's
So
not a
this
direct
is
lending
this is
to
a different
nursing
kind of
student.
thing that's being created now. Yep.
Okay, so
And we have loan repayment for physicians, but not nurses.
And physician assistants.
Gotcha. Well, this new program, would this be directly loaning to the students, or would this be additional grant money?
So this is loan repayment for the students. It would be run through MDH, and it's modeled after the physician and physician assistant program. And then, as I mentioned, there's limitations.
Okay, so do we have any idea
Practice
how
that
many
they're doing, and
people?
if they're in certain geographic areas?
Do we have any idea how many people would potentially use this?
That's a question for the stakeholders, so we'll get to the stakeholders.
Okay.
I think
If you can
it's
answer
an
that.
important
Thanks.
question. Let's hear from Delegate Cullison, and then we'll let the stakeholders have a minute. Go ahead, Delegate Cullison.
Thank you, Madam Chair. So I just am wondering how the loan program for physicians is currently paid under MDH. Is that part of the?
That comes from licensing fees for the
Licensing
physician and
fees.
physician assistants. There was a stakeholder work group recently that met, and Erin Dorian, I know, played a big role in that. So maybe she can speak to it if she cares to, but that was looking at finding a different kind of payment structure for the physicians MLARP as well.
Okay, all right, great. Thank you. Thank you, Madam
That's
Chair.
actually, Erin, can you give us, I remember that was happening and that there was some sort of move. Is that shifting this legislative session or not? Do we know? in terms of the physician program?
No, unfortunately not, although there is money in the budget, and Steve Wise, where we worked hand in hand on this, there is money in the budget for the physician and physician assistance program this year. If nothing is done next year to resolve the funding issue, it will revert back to that $400,000 out of physician licensure fees. So that's.
Thank you for that clarifying answer. And this is why I think we need to discuss all these bills together, right? Because I think Delegate Collison is aware, I know I am aware from work on the other nursing bills, that the nursing board, I think there's a lot of pressure on them right now in terms of the licensing fees and all of this. I think there's a concern about the structure. And if the physicians are trying to move one way and the nurses get put in permanently another way, it's complicated. So let's hear from Delegate Riley. Go ahead.
Thank you, Madam Chair. Okay, so the question is, right now, the 2 million that we were talking about that we could get and move over from MHEC. Now that 2 million that's in MHEC, is that for underserved areas as well? People that are underserved, is it the same stipulation, or is that for everyone?
This program was modeled after the program for physicians, which is aimed at getting physicians who practice primary care into certain underserved areas of the state, rural communities.
Okay.
And so I'm not certain if the subcommittee feels that some of that language might not apply for this program.
So let me go to Mr. Lucci, because I think he probably can give us a sense of, I think the questions we're hearing is that moving the governor's money appropriate for this program that you have designed, and how does that fit? So maybe you can answer that for us, Len.
Sure. Thank you. This bill is a joint product of, again, 1199 Maryland Hospital Association and MedChi, who's employ a lot of nurses. And it's modeled, as you said, after the physicians bill. We would support the appropriations amendment to have it diverted from MHEC to MDH, where the doctor's program currently is. We think that could be done without too much problem. The language and the governor's budget pretty much matches the language of the bill in terms of being a loan repayment program for nurses. We think, again, this bill is very important to increase the pipeline for people who are in the nursing profession but not nurses to then get the certification to become nurses. And we think it's just one more tool to address this very serious problem right now. Even though COVID is subsiding, the nursing staffing shortage is not.
Thank you for that. I would like for the committee, since we have another nursing bill to discuss. We have 4 minutes left before we go to Delegate Bagnall's bill. I want us to get a sense of everything so that when we come back to this next week, we can really be refined. So I'm going to put a pin in this conversation, although I know it could go on a long time. I promise we will have this conversation again next week. Let's talk for a minute about 1208, which is the healthcare workforce expansion bill, which I know Lindsay worked on because she worked very hard on it. No? Lindsay,
I actually drafted this, but Lisa's been handling it for the committee.
Oh, for the love of God. I'm trying so hard. Lisa can give us an update on this one.
As drafted, this bill requires the State Board of Nursing to issue clinical extern certificates to eligible nursing students so that they may practice at a hospital or auxiliary treatment site approved by the Board of Nursing and perform and provide healthcare services as specified in the bill. The bill also establishes a licensed practical nurse and registered nurse preceptorship income tax credit and creates a stakeholder work group to study expanding the state apprenticeship programs to the healthcare workforce. Lastly, the bill creates additional responsibilities for the Board of Nursing relating to the expansion of the workforce in nursing related fields, such as requiring a marketing plan and an evaluation and allowing on-the-job experience as a nursing assistant to count towards certification. There are 2 different amendments that were distributed. One is on page 15. And this one strikes language regarding the clinical extern certificates, requiring the board to create and implement a marketing plan, and requiring the board to create and maintain a publicly accessible website for individuals seeking licensure or certification. So those provisions are gone. The amendment also clarifies that provisions allowing an individual to apply on-the-job experience toward the training hours for certification applies to applicants practicing as temporary nursing assistants, and it specifies that a certain tax exemption applies to advanced practice registered nurses rather than nurse practitioners. Then on page 17, you have some more amendments. They require the board to adopt regulations for online provisions of nursing assistant training programs. They also require the board to approve the use of nursing assistant training sites provided by nursing assisted training programs within 14 days after the program request approval, if the program had previous approval by the board. And then finally, those amendments also clarified that there were provisions regarding certification and they only apply to geriatric certification.
Okay, so thank you for reading all of that. As you guys may remember from the hearing, we had amendments from the Board of Nursing and amendments from the Nurses Association. We also have some new amendments in this package suggested by, I think it's called It Works, Neil. It Works, yes. So we have almost no time left to discuss this, but I do want to give people an opportunity to get a sense of what's going on. I think we're getting to a place where we have some, substantive things in this bill that everybody can agree to. One major thing that the Board of Nursing wanted was to take out the externship program. So that's sort of a really substantive change. And I think we need to come up with an alternative plan. Do we have anyone from the Nurses Association here on the call today? I don't know if Robin or Scott is here.
I'm here.
Oh, you're here. Okay, good. Okay, so I'm going to hear from Karen and Robin and maybe Aaron on sort of where we're at now, what we think with those amendments, and then I want to give Neil a chance to talk specifically about the online nursing assistant training, which I think we need to deal with. So let's start with Karen, because this is all in your house, my friend.
Hi, everyone. I'm sorry, I was just hopping off of another meeting. Good morning, good afternoon, everyone. So for the clinical extern piece, per my my testimony, I believe it was last week, we would like to offer a different a different alternate. And that is real. I would like to work with the chief nursing officers from long-term care and from acute care, as well as the schools of nursing on all different levels, meaning LPN, RN, associate degree, RN, baccalaureate degree, and RN, MSN pre-degree, and come up with a different scenario similar to something that is at Northeastern University, which is a co-op program, not necessarily that particular program, but I think it would be beneficial for all of us to sit in the same room and sort of think outside of the box as to how we are functioning now, especially with the pandemic that we're slowly easing off of right now. I think we always still need to be prepared in case something like that happens again. It's interesting that I'm on the board of directors for the National Advisory Council of Nursing Education and Practice. And believe it or not, in 2009, they have wrote to Congress to ease regulatory boards to ease how they do nursing programs and other things to what we're going through would have made it a lot easier than what we're going through right now, or how we had to adjust a lot of things. So that's something that still needs to be worked on, but I really would like to work with those two groups and be able to provide Delegate Kelly and others with a solution to this problem so that nursing students still will be able to function in that role and obtain clinical, which will in the long run benefit both long-term care and acute care, because they will have someone that comes out that has some skills already, and it will be easy for them to be acclimated into their new role as LPN, RN, or what have you in that phase. So I would like to do that instead. So if you give me the permission to move with that, and it's fine if you tell me to do a task force, I'm okay with that as well, to make it happen.
Some sort of structure there. So let's hear from Robin and then Aaron. Robin.
Thank you so much. Robin Elliott here on behalf of the Maryland Nurses Association. In support of the bill, strong support. I wanted to flag one particular provision that's really important to us, and that is the preceptorship tax credit. This has been a long-standing problem where nursing students can't get clinical placements. It got much worse during COVID, and really having some kind of support for those nurse preceptors to incentivize them to do this, I think will go a long way in addressing some of the pipeline issues. So really appreciate everyone's work on this. Thank you.
Okay, Aaron.
Thank you, Delegate Kelly. So I will just say that, we were disappointed that we can't move the extern program forward in the way that we were able to, under the public health emergency. Completely understand where Ms. Evans is coming from, though, and are looking forward to working with her on developing something that will allow students to work for pay while they're in nursing school, up to the level of their education, so that they can actually get that clinical experience and also, have a job, and then hopefully continue to work in the institution where they are, where they have their co-op or externship or whatever. So it's a win-win for everybody if we get that going. So we are looking forward to working with Karen. Our CNOs are here, and we'd be happy to help work out the language to put that in the bill if that's where the committee decides to go.
Yes, and do you mind, Delegate Kelly,
please,
if I add
please,
something?
Please.
I can just tell you I'm a product of Northeastern University's co-op program, and it was amazing. I may not have enjoyed school while I was going through it, but at the other end, I really was prepared for the work world. And I could run circles around my other fellow classmates who graduated at that same time. So it's a wonderful program, and it really also helps the students pay for their tuition and other things. It's really great.
So maybe we can work on tweaking these amendments a little bit to get a little bit more structure in some sort of commitment around a work group or stakeholder group to look at, does that sound like a good plan to folks? Okay, I do want to, let's see, we're so close to out of time. Neil is here to talk to us about the online nursing assistant training and other things. Why don't you give us a 2-minute spiel?
Sure. I may even need less than that, but thank you for the time. Yeah. I'm here today on behalf of It Works Learning Center, which is a training school for certified nursing assistants and geriatric nursing assistants. And essentially, they've been having issues with processing of licensure throughout, the pandemic and so on and so forth. We were really grateful that Ms. Evans and the Board of Nursing met with us a few weeks ago to sort of work through some of these issues. But as far as the bill goes, we wanted to talk a little bit about the online training piece and how that's been so valuable to It Works and other learning centers throughout the state. Essentially, having the ability to provide training through the online platform for the classroom learning has given students an opportunity to access training in ways that they haven't been before. And we're working with the Board of Nursing to get a training course approved moving forward. We understand that they want to keep the clinical training piece in person. That makes perfect sense as far as being a hybrid course. But we do think that online learning, as far as the classroom piece, is important and really helpful.
That's it. That's all you got.
That was the first issue. The second issue is about the training sites that have been previously approved by the Board of Nursing. We understand that the Board of Nursing has delays, has staffing challenges, et cetera. But for those training sites that have been previously approved, we would ask that those sites be, the approval be expedited for those particular sites, just because they've been approved before. And we think that would help schools move forward with their programs more easily.
So is that something, Neil, that is we need to put in the legislation? Is it in your proposed amendment, or is it just you're asking Ms. Evans if we can figure out how to do that?
So you have a proposed amendment on the expedited approval on the training sites, and then you do have an amendment on the online approval or online provision aspects being having requirements established by the board. So both of those pieces are in there right now.
Okay,
So
and
can I?
please do.
I'm sorry, Delegate Kelly. Thank you. So, but I did. It was a pleasure meeting Neil and the last few weeks. So I really don't think you need a bill to do in a statute or anything to do all of that. So for the hybrid, we've already approved Beacon. So that's a program we just approved last month.
And the board,
so that's a hybrid program. So they're doing online, and then they're doing the clinical in person. So you really don't need to add that, because our statutes and our regs are loose enough in order to be able to do that currently. So there's nothing else needed there. As far as expediting anything, I need more staff in order to be able to do that. That doesn't require, I don't think, anything in the statute. And right now, I've just asked everyone, remember, we're still working with inadequate equipment right now, secondary to the cyber incident. So we have limited the servers and the databases we're using still are not at full functionality and capability, and we still don't have access to our desktops, or our F-share drive, which has all of the information. So we're sort of working in we have to create everything new. So that's going to take time, especially when I'm already down about 10 staff members. So I just everyone to be patient. I'm working as fast as we possibly can. And remember, we do have a process that we also have to go through. It has to go through CNA Advisory Committee first, which that meeting was today. Then tomorrow will be practice and education. It will get approval there. And then it goes to the board for final approval at the end of the month. So there is a process that we have, and having a program in the past should not be difficult in getting that renewed. Everything just has to be submitted on time, and it has to be submitted in a time that it's going to go. I have one person doing over 400 programs right now. So I'm just asking for some patience. We're working as fast as we can with what we have.
Okay, I see Dana's hand is up. I just want to note, because I think I have been following for 2 years this Beacon approval, and it's been really hard. And at last I heard, MHEC had still not done their part to approve that. Is that been resolved?
I'm not sure, Delegate Kelly. I did send them that we have approved the program. I can follow up with them.
Okay,
but,
let's hear what Dana has
on
to
our
say.
end.
Okay.
Yeah, on our end, we're fine.
Okay, Dana. Dana's on mute.
Thank you. Sorry about that. And Ms. Evans is correct. We're very appreciative. The Board of Nursing has approved it. They've actually approved it twice now. But unfortunately, the Maryland Higher Education Commission has not responded back. It's been 2 weeks since I think the last conversation that took place between the board, the commission, and the Beacon. And we heard just today, it's my understanding that they're still waiting for approval from the board, but that, as Ms. Evans stated, has already been given. So honestly, I'm at a loss.
So I don't have a problem, Dana. I'll follow up today.
Thank you.
Okay, I'll follow up, make sure they received everything. If something's missing that they need, we'll make sure that they get it today.
Thank you very much.
So the one takeaway I
You're
want the
welcome.
subcommittee to have from this conversation is that, and we will pick it up next week and try to figure out exactly what the language needs to look like to meet everybody's needs. The stakeholders have been working really well together to try and make sure we can both support the Board of Nursing and get the nursing shortage addressed and help the workforce. There's been a lot happening in this space. I see a question from Delegate Krebs, which we will go to. I will update the committee. It is 12:23. So 12:30 will be our hard stop, which means we're going to make this very brief. Delegate Krebs.
Just ask for our next meeting if possible. There's lots of amendments for all these bills. If we could have reprints so we can read them all in context, it would be very helpful, but thank you.
Absolutely. I want to put a pin in this and go very, very quickly because I see Heather Scheck is here and she's been waiting patiently. I imagine you're here on 407. Is that right, Heather? Or maybe she's just listening in. Oh, Jake is here. Jake is here on 407. Okay, so we were going to sort of discuss this bill in the context of both the last bill we discussed and the workforce, whatever it's called, the commission. That's my bill. The Senate has moved the commission bill. They have some amendments on it that we do need to look at to see if we like their amendments that move some stakeholders around. I don't know what I haven't read them, but I'm sure that they're very good. But we will discuss that next week as well. But in that context, let's also talk about the staffing shortage emergency bill. Jake, why don't you give us 2 minutes of your best spiel?
Sure. So I'll be very quick. The amendments reflect the most recent healthcare matters emergency order. We think that's a proven concept. That language was used in some of the most clinically demanding circumstances, and we feel like it's a proven concept that we can move forward with as the committee deems appropriate. So I'll just leave it at that in the interest of time.
Okay, super. Thank you. I think, Lisa, you're the staff person on this bill, or Lindsay, sorry, Lisa. Do you want to just remind us what that bill does, House Bill 407, so that the committee can think about it?
Yep. So House Bill 407 is an emergency bill. It provides the Secretary of Health, it authorizes the Secretary of Health to declare a healthcare staffing shortage emergency. The Secretary must establish criteria for determining the conditions that require such a declaration, and a declaration may not exceed 180 days. All of the health occupations boards must establish processes for the issuance of an initial health occupation license, a temporary health occupations license, and a temporary practice letter on an expedited basis during a declared healthcare staffing shortage emergency. The Secretary may direct the boards to implement these expedited licensing processes during a declared healthcare staffing shortage emergency. And the bill also authorizes healthcare practitioners to practice at healthcare facilities without a license or temporary practice under specified circumstances.
Awesome. So we obviously do not have a time for a robust discussion on this bill right now. So we will put this to I think we're going to meet twice next week, first meeting of next week. Let us any urgent questions on this before we pick that up next week? If not, we can return to Delegate Bagnall's bill. All right. How are we doing, Delegate Bagnall?
I think we're in a good place. I'm going to give you a very, very quick update. We do have consensus on the amended language that we shared with council and with the committee. We did, in the middle of this subcommittee, get one concern, which was a technical concern where our tenses didn't match. There was a reference to was, and then is. We have requested, and we have requested that technical change from the amendment office, but the stakeholders have not been made aware yet of that because it happened in the middle of the subcommittee. But I do want to say thank you to the board and to all of our stakeholders, because they have been working in good faith for the better part of the last 2 days to get us to consensus.
So it sounds to me like we have basically, if the subcommittee is comfortable, amendments in concept that we can move that are similar to the amendments they have seen, but need some technical changes.
Yeah, it's literally one word. We have to change an is to a was.
All right. Is the subcommittee comfortable with that? I'm not seeing any concerns raised. This is a Lisa bill, right? Lindsay bill, Lisa, they're all Lisa bills this week. Lisa, is that something we can work with process wise? Are you comfortable with that?
I think so.
Okay, so with that, does anybody on the subcommittee want to move the amendments in concept?
Move the amendments in concept.
Second in concept.
Excellent. Any discussion on the amendments? Any questions on the amendments? Delegate Krebs.
I'm sorry, I'm trying to follow this. I do have an amendment in my packet that strike is and substitute was. Is that the concept that we're dealing with here? Or is it reverse?
It does strike is and changes it to was, correct.
So it's not a conceptual, I mean, it's the amendment we have in front of us. So can you
That's
just
the
tell?
substantive amendment. And then there's also another technical amendment that changes the tense of something, if I understand correctly, right, Delegate?
Correct. We had the substantive amendment, I think is pages 8 and 9, if I'm correct.
I just have. I'm confused with it, what we're doing here.
So maybe we need to hear from, do we have Dr. Savage? Is there someone here who can explain to us substantively what changed to get the board on board?
I'm here.
Okay. Can you help us understand what is substantively changing in the amendment aside from the technical amendment that's coming?
Sure. If you look at, I guess, section 2, subsection 2, there was it says a postdoctoral respecialization certificate that was issued by a Department of Psychology. At the time the certificate was issued, had a degree program that is accredited by the American Psychological Association or the Canadian Psychological Association. That includes. And then there were 2 pieces that existed in there that were broken apart in order to assure that there's clarity to the people that are going through this process, that they must take a supervised internship in accordance with regulations adopted by the Board of Examiners. And then secondarily, they attain a minimum of 1,500 hours of post-certification and advanced training. And we broke that into a separate number because we thought it could be confusing to people seeking certification, that you must do that while you're in the post-respecialization certificate program, rather than that can be done separately. And the board agreed to that. We agreed to it. And so that was the change. It was just a formatting change to make the bill clearer in terms of its intent.
And Ms. Smith, I see you nodding your head, so that works, right? Excellent.
To the very beginning, it just says a practice-oriented postdoctoral respecialization certificate through a degree
Do
program.
we want to hold this bill
No, I
because
don't wanna hold
everybody
it.
needs lunch?
It's sort of simple, just easier when you have a reprint. I'm sitting here trying to scratch stuff out and add it in there, but I think I've done that. I think I've reprinted it in my own words here. So I'm okay with that.
Okay, so we're okay. So the amendments have been moved and seconded. All in favor of the amendments, say aye. Aye.
Aye.
Anyone who's opposed, raise your hand. On the bill as amended, who wants to move it?
Move the bill as amended.
Second.
Moved and seconded. Any further discussion on the bill as amended? Okay, all in favor, say aye. Anyone
Aye.
who's opposed, raise your hand in the chat. Thank you to, passes unanimously. Thank you to the stakeholders for working this out. We really love to see this in this committee, so I commend everyone. Passes unanimously. We will convene twice next week to take up the rest of these workforce bills, and I really thank the committee for your hard work. Enjoy your lunch.
Thank you.